Hello, everyone, and welcome to another great episode of the Jason Howell Company Speaker Series Zoominars. My name is Jason Howell. Today's topic, how to navigate healthcare planning. Now, most financial advisors are very comfortable with wealth care planning, but health is wealth, right? So how do you work around healthcare? How do you make that for your clients something that is not to be afraid of, especially in that second half of life, which too many of us are actually approaching these days? Well, to answer those questions and many more, we've got a super guest, Christine Simone, CEO and founder of Caribou. What's Caribou? How do we answer those questions about healthcare planning? Soon enough, we'll get to all of that. Right now, let's just meet Christine. Christine, welcome to the Zoominar. How has your day been so far?
Hey, Jason. So happy to be here. So far, beautiful fall morning in San Francisco. Went to yoga this morning. Really, no complaints. It's an awesome Monday so far, and I'm excited to be here with you.
Of course, San Francisco, the capital of the startup world,
Yeah.
and yoga also very healthy here as we talk about healthcare planning. Well done.
I am a living, walking stereotype of people who live in the Bay.
Rock on. We'll take it. We will take it. Well, let's go ahead and share our screen and get right into the Q&A. I know anyone that's jumped on here is certainly interested in that. Once again, we're talking about navigating healthcare planning, how to navigate it. Christine, thank you so much for being a part of this conversation. Your expertise is going to be really helpful.
Super excited to dive in.
Oh, great. Before we get right all the way in, let's just get a word from our sponsor. And our sponsor, of course, is the Jason Howell Company. Jason Howell Company is a family wealth management firm specializing in sustainable investing and family governance. We're able to compete with some of the most well-known private bank and wealth advisors by forming a virtual family office with a team of experts and specialists. Experts just like Christine. We're based in Northern Virginia, just outside of Washington, D.C., but we serve clients nationwide. For more about Jason Howell Company, just go to jasonhowell.com. And with that, let's move on to our guest. So Christine, one of the great things about you, what did you say, typical San Franciscan, is that you have had this really interesting background for people who are not in the startup land. I would love to hear a little bit about how you got involved with startup world, how it was an interest of yours. Give us a little taste.
Yeah, well, I went to school wanting to be a doctor. So I
Okay.
always loved like the sciences and healthcare, and that was always going to be part of my future. I thought mostly because really that's what they teach you in school is that if you love sciences like organic chemistry and biology, which my degree is in, then you become one of three things, a researcher, a vet, or a doctor. So I thought that I was, on that track, but luckily enough, started to just get really interested in more of like the business side of the healthcare system. Ended up not starting a master's in neuroscience and physiology, which I was going to do as an
I
intermediate step.
also was considering that, but just decided to stop it. Not at all.
Well, thankfully, I was comfortable with taking, a quick pause or a quick pivot, exploring some other areas that I felt were calling me a little bit more strongly than more schooling was, and ended up just like absolutely falling in love with it. So I joined a startup. It was a medical device company. We sold electronic glasses to people who were visually impaired, and I
Wow.
basically just absolutely was so heavily influenced by the change that you can make in the healthcare world by being more on like the business side than in the clinical side. Not that the clinical side isn't important, of course. We need very smart and capable doctors, but I felt that more of my strengths were really pulling me towards more of the tech side of things. In that role, I really saw the big disconnect that consumers have between accessing their healthcare and then paying for their healthcare. And a lot of my job was to fight with insurance companies to
Oh,
appeal
wow.
denials for the device that we were selling. And so, with that experience, I really learned the ins and outs of the insurance landscape, the big knowledge gap that most people have when it comes to what insurance they have, what it covers, how to work within the confines of all the complexities that insurance companies are, and really wanted to help solve that problem for people by first and foremost helping them make smarter health insurance choices, educate them as they're going through that process. And that's how slowly but surely Caribou came to be.
Oh, neat. And it looks like you had some experience even in this case with veterans as well. What was that like?
Yeah, exactly. So that was all part of how we could get that device in the hands of more people through different distribution networks. And the VA was one of those distribution networks for us. It was actually one channel where we could get some funding, for lack of a better word, grants or subsidies for the device through the VA if you were a veteran. And so building out different relationships with VA hospitals across the country was also part of my job, getting the device into the offices of ophthalmologists, optometrists, getting people to try the device, basically meeting them where they are. But also a big part of our kind of sales strategy was just direct to consumer advertisements. So balancing both of those two was really interesting. Of course, I lean towards more of like the clinical side, wanting to meet those patients, in the offices of where they were already seeking care, but learned a lot about the just, again, the disconnect between the actual patient and then the provider, and then what insurance will cover.
Yeah, your work is so important. And I know we have started to partner with Caribou and have had a great experience. My alma mater is George Mason University. Love to give a plug to George Mason University out in Fairfax, Virginia. And our relatively new, though he doesn't like to be called new, dean of the College of Business always says that everything is business. So
Yeah.
this is the business of healthcare.
Hmm.
And you are still critically important within that system because every one of us has experienced that challenge of getting an insurance rejection at first and then following up and then realizing, oh, it cleared. Then why didn't it clear the first time?
Yeah.
I'd love to speak to, I highlighted this phrase that you had in here, health planning coordinators. Would you consider that on par with some of the health concierges that I hear about now and again?
Not necessarily, because concierge too is not to be confused with like a concierge medicine doctor, right? Which is
Sure,
providing
sure.
typically subscription-based medical services that is not covered by insurance. So it's an
Okay.
important distinction. Our internal nomenclature around the team of ours that they are insurance experts. They talk to advisors and their clients daily. They're explaining a lot of these insurance concepts. They're helping people make decisions about their insurance. They are helping clients think both short term in the sense that we need to pick a health plan for you today. Maybe it's open enrollment like it is now, or maybe you're retiring or going through some other life event. But they're also planning. They're helping you think long term. How does this impact you long term? How long will you be on this coverage? What will your costs be longer term? And that's where it's important to have the advisor looped into the process. So that was sort of a name that we carefully chose
I'm sure.
to to explain kind of what these people are doing. You can kind of think of them as guides or navigators as well. We went through all of those sorts of different terminologies as we were kind of picking this name. But we wanted it to seem like a perfect blend of something that was healthcare and medical, but also planning and financial, hence health planning coordinator, which is also a kind of a mouthful.
Well, it's as good as anyone that I could think of. I would spend days and weeks and months on that area alone. Just like, how do we pick a title for this?
It's
Let's get
important.
into some of this Q&A and to level set for everyone. Christine, how do you define healthcare planning?
So the way that we look at healthcare planning, there's two really important words, and that would be personalization and optimization. So a lot of what we do is really highly personalizing health plans and long-term financial projections to the client by using information like their health conditions, their medication list, their doctors, but also other preferences such as, do you have a home in a different state, like a vacation home, or do you travel frequently? Have you worked with a certain insurance company for 20 years and are super familiar with them and like them? Are you okay with getting approval for certain services, or do you prefer more flexibility and want to go to see anybody that you want? So those are some examples of personalizations that we put into the guidance that we offer to clients around which health plan is the more optimal health plan for them, which leads me into part two, which is the optimizing component of healthcare planning, which is this is something that needs to be done annually with clients or with anyone, even if you're not working with an advisor. This is something that you really need to be looking at every year because not only are your needs changing, especially as you're aging, your healthcare needs will evolve even quicker than they have in the past when you were younger, but also the health plans themselves are changing, the premiums, the deductibles, the provider networks. And so there is typically a lot of money left on the table by people who just auto renew every year. They're just in that auto renew kind of mode. And just like an investment strategy, a portfolio, or a financial plan, if you picked, your plan, your assets, everything, and then put it in a drawer and never touched it again, it would go stale very, very quickly. So that's the same way that we look at healthcare planning, which is that the optimization piece is really, really important too, to be looking at this every single year.
Yeah, I teach at that alma mater of mine, George Mason University. And when we get to health insurance conversations and topics, because we talk about financial planning, and this is a part of it,
Mhm.
I've mentioned the reality that 65-year-olds plus face, which is at that point in your life when you are trying to slow down, that's
Yeah.
when your health insurance and healthcare gets the most complex. And
Yeah. Speeds up.
right? And why don't you have that at 25? It would be a lot easier.
Yeah.
But thankfully, you're here to help sort that. So two things out of that: personalization.
Mhm.
We're all different, and because we're all different, and because the industry and the care, the way that we do care changes, optimization is that second piece, and that
Mhm.
optimization reflects that personalization in case those drugs change, in case the cost of those medications change or the service provided by certain doctors change.
Yeah.
Really neat that that's something you pay attention to.
Yeah.
Um, you work with a lot of financial advisors. I mentioned earlier that we've begun a relationship with you, Christine, and your firm. What do most financial advisors that you run into, especially the ones who don't say, "Yeah, let's work together," what are they
Yeah.
missing? What are they getting wrong about this space?
I think that a lot of them, understandably so, are just not confident in approaching healthcare with their clients because it's not their area of expertise. And so while that is probably true in most, if not all cases, the perspective that we're trying to give advisors is that you don't need to be the expert. But your clients are looking to you to provide at least the resources or the connection to somebody who does have the answers. And if you find a partner like us that can deliver a feedback loop back to you, it will make you a stronger advisor, a stronger planner, because you will be able to embed those insights, those estimates into your financial plan. So I think a lot of advisors just resort to using estimates or, if Fidelity produces a number every year, for example, we've done studies where we have just shown like case studies where we've shown clients that come in way over that number and clients that come in way under that number. And, that can have negative consequences on both ends of that spectrum when it comes to how you are spending your money in retirement. So we are really trying to encourage advisors to not, I wouldn't say like step out of their comfort zone because this isn't them necessarily stepping out of their comfort zone because they're not becoming the healthcare experts, but recognize at least that you can find a trusted partner that can work with you to deliver healthcare planning in a way where you get all the credit. Like that's our goal. And you might have noticed this in your experience working with us so far. We do not want the credit from your clients. We always say, we're a partner of your firm and you only have access to this service because you are a client of the firm. And we always try to relay it back over to you so that clients are coming to you with these sorts of questions and engaging you, which is great for your relationship with them. And then it strengthens that bond that you have together.
Now, I'm just going to read that quote again. Your clients are looking to you as a resource. That is
Yeah.
100% true. And, my favorite phrase to hear from anyone, including a client, is thank you. And we get super thank yous from
Yeah.
clients when we look at this area.
I'm good. I'm
Oh
glad.
yeah. Oh yeah. Well, how do you see technology? I mean, you're a tech person, you're in the tech capital. How do you see technology playing a role in reducing the overall cost of healthcare? I think you touched on it somewhat, where you said, people are just sort of renewing without thinking. How is
Mhm.
tech making that something that you can optimize?
Well, we can't change, healthcare costs rising faster than inflation. We can't change what insurance companies are charging for services based on negotiated prices with different facilities. Those are things we can't change. But what we can change using technology is that we can help the consumer or the client better understand their coverage and find plans that are most optimal for their specific needs so that they're not under or overpaying because both can result in downstream, higher costs, whether that's through out-of-pocket expenses or just in paying a lot in premiums for coverage you don't necessarily need. So that's where open enrollment, which is what we're in the thick of right now at the time of this um, Zoominar, I think you called it,
Yes.
at the end of October, where Medicare open enrollment has already started and Marketplace open enrollment is starting soon, November 1st. This is the time of the year where you can change your coverage. So this is when you can look at other options. This is where you can sit down, reflect on the last year. Did that HSA high deductible plan work out for you? Do you need access to different doctors that you don't have access to today? Things like that actually will save you tons of money down the line if you can just take that 30 minutes, 60 minutes, maybe it even takes you a couple of hours because you've really got to look into things, learn different concepts that you might not be too familiar with, but it will save you time down the line. And using technology like ours, where you can, input all that information, like your doctors, your medications, your income, things like that, and just spit out a recommendation in terms of
Mhm.
which health plans best match you. That's how I think we offer some financial relief to clients, I guess, not necessarily solving the bigger problem of rising healthcare costs, but
Wait, you're
at least,
not?
no, unfortunately not. But we're at least,
Oh, like, why are you here, Christine? This is why I had you on in the first place. I thought you were going
maybe
to fix
maybe
everything.
maybe my next startup can tackle that.
Okay.
But right
Okay.
now this is a real like education play, a real kind of strategy around how do we help the consumer better understand their coverage and help them save money. There are some awesome companies helping on the other front, like for example with like companies like GoodRx or Mark Cuban's company that help you kind
Oh
of cut
yeah.
out intermediaries and get cheaper medications, or companies that are surfacing transparent data around what to expect if you needed a knee replacement at so and so hospital provided by so and so orthopedic surgeon. A lot of that data is transparently available, but people don't know where to find it. Right. So that's where
Yeah.
that's where we're playing our part by helping people understand, hey, this medication is actually cheaper if you just go buy it on GoodRx instead of getting it through Medicare. We tell people that all the time. So we play nice in the sandbox with all those other companies that are doing important things in this area too.
Yeah, I mean, that's how I see it. It's this idea of transparency. And in our business, it can be similar, say, on the investment side. If you have this fund versus that fund, if it's the
Yes.
same elements of the fund, then why are you paying a higher fee? That kind of a thing. The more consumers can see what the cost choices are, is the more opportunity they have to make the decisions that they can make. They're really smart. They just need to know what the options are, essentially. So thank
Exactly.
you for being a part of this. And while we're on the topic of Caribou, let's speak to it. Tell us about the process that you go through as an advisor with a client working with Caribou.
So the way that it works, and we only work through advisors, so it can be that value add service to an advisory firm. The way that it works is that an advisor will kick off the process by identifying what we call a life event or a healthcare planning opportunity, which could be everything from open enrollment, which we're in now, to retirement, to losing your job. Maybe you're turning 26 and aging off your parents' policy, or maybe you're turning 65 and aging into Medicare. There's lots of life events that could happen that basically kickstart the opportunity to review your coverage, whether that's changing your current plan or enrolling in a brand new plan, like in the case of Medicare when you turn 65. So the advisor will identify that opportunity. They will enter the client's information into our platform and send the client an invitation. The client will be the one to fill out their medications, their doctors, their income, other personal information, most of which is not shared back with their advisor. We just use that internally to actually better understand the client and make the recommendation in terms of which health plans to consider. And when they submit that information, that's where they're given that health planning analysis, which going back to the health planning coordinators, it's all related in our nomenclature of how we refer to things at Caribou. So they'll be given basically an analysis of 3 to 5 different plan options. They have all been basically matched based off of different priorities the client listed. Maybe their doctors all being in network is their top priority, or they want the least expensive plan possible, or they really want an HSA compatible plan. So we'll show them a variety of options based on those preferences in their profile. And at that time, the client, the advisor, and our team will have a conversation where we can be the ones to walk them through the results of the analysis, answer any questions that they have. Going back to my earlier point about the advisor not needing to be the expert, the advisor's looped into the whole process, but in nowhere in the process are they the ones answering the questions of what's an HMO versus a PPO versus an EPO. That's where our team can come in and be the ones to provide that clarity to clients, but the advisor is involved along the way.
That's neat. Let me see if I've got these steps, and this will be helpful for other advisors who are interested in this or at least want to consider it. So
Yeah.
step one, we enter basic information regarding our clients into your system. Is that right?
Yeah, name, email, phone number.
Name, email, phone number. And then from there, we initiate an invitation to the client. At that point, the client fills in some of the more personal healthcare stuff that we won't, as advisors, actually see. We certainly don't need to see, right?
Hmm.
They maintain their privacy, their HIPAA compliance, and the like.
Hmm.
Subsequent to that, the healthcare planners start to get involved to be able to review this information with the client. Now, they're doing that on their own first and then bringing us in, or how is that working?
They do it on their own, typically at home. They're filling
Okay.
out their profile online. If they have any questions, they can call us. And then once it's submitted, that's when the advisors loop back in and we schedule that phone call. Both
Okay.
the advisor and the client will get a copy of the results, so you can review it in advance of the phone call as well.
Okay, terrific. And then I guess amongst the three different parties, your healthcare planners, the advisor, and the client, were able to select the most optimal, personalized plan
Yeah.
that works for them for that year.
Exactly. For that year, hopefully we see that client again next year, unless something happens in between because of some other life event.
Okay. Well, that sounds not only straightforward but thorough, as it were.
Yep, yep. And the one last thing, I guess, to kind of close the loop in terms of enrollment. So one really important part of why I built this company and what we do is that we are not insurance agents. So we don't actually sell the health plans. So that means that we can be completely unbiased. We have no incentives based off of any selection that the client makes. And we have no limitations based off what products we have available to anyone who's looking at the options on our platform. So we truly do represent everything that's available. So that does mean, though, that the client has to self-enroll in the plan. So that is kind of the last part to get across the finish line that we can walk clients through how to go into Medicare.gov or healthcare.gov, or if they prefer to pick up the phone and call the insurance company, we provide them with what's called a plan ID that either of those means will recognize to make the enrollment as easy as possible.
And an important point here is this isn't just for folks with Medicare. This is anyone post 26 that needs their own health insurance. Is that right?
This is everyone who either is on the marketplace or needs
Mhm.
marketplace insurance, which is available to anyone under 65
Yep.
and anyone on Medicare. Sometimes you have even small business owners on the marketplace because they don't qualify for larger group or employer plans,
Yeah.
or you have students on the marketplace as well. So those are the two forms of insurance that we have available. But sometimes clients come to us and they have COBRA coverage or they have a retiree health benefit package. And they say, I want to compare this option to Medicare or to the marketplace. And we can most certainly help them with that.
And if I'm correct, Caribou makes their money with it and from advisors. And so advisors can choose to pay a fee for a certain number of seats. They could pass that flat fee on to the clients if they'd like. But that's, as you mentioned, you don't have any commission structure. That's the way that Caribou makes its money.
Exactly. It's just a software fee paid by the advisor at the advisor's discretion to pass the fee through to their clients. And we charge on a per household basis. So basically like per engagement.
Okay. I think that was it's clear for everyone and thank you for sharing that. So Christine, you're in it now. You're in the business of insurance, but you are still knee deep in it. What do you see as the future of healthcare planning? I know I just said insurance, but in our country, it's a lot of health insurance planning more often than not. But let's talk about healthcare planning in the United States going forward. What do you see over the next 5 to 10 years?
Well, we're only tackling, as you've mentioned, a small part of it. We believe that's like phase one of healthcare planning. But as I'm sure you know, but maybe listeners to this might not know, for example, like long-term care is not covered by Medicare. So how can we expand our knowledge and offer the same type of support to clients to plan for those costs? There are insurance policies available to clients should they wish to select them. There's a bunch of different forms of long-term care insurance, but some might choose to self-fund those expenses. They still might need to know based off of where they live, their family history, things like that, what their personalized costs might be. So that's an area that we're excited to get into in the future or find a great partner that does that already to provide more of a holistic view on overall healthcare costs. Same would apply for other forms of insurance, like even vision, dental, which we get a lot of questions about, life
Hmm.
insurance. These are all things that are all related, and we believe the future of healthcare planning involves these different pillars as well.
Excellent. Well, thanks for sharing that. And everyone brace yourselves. I'm going to go to big pictures here, big faces. Christine, this has been so educational, which is really the purpose of these Zoominars. Having an expert like yourself in the world of this particular topic is rare, and be able to have this kind of conversation. Anyone watching this later, what would you say is sort of the first one or two things that a person should do when they are trying to begin the process of healthcare planning?
Am I speaking to an advisor? Am I speaking to a typical consumer?
I'd say a typical consumer, maybe who needs to work with an advisor.
Well, in that case, I would say step one is definitely the education. I don't remember the specific number off the top of my head, and the study is even a few years old, but most people, well over 50%, and I think it was above 75% of people, cannot explain what a premium deductible, copay, or coinsurance or
Wow.
out-of-pocket maximum are.
Wow.
So it all starts with education. There is a huge healthcare literacy, I think,
Hmm.
problem that will solve some of what people experience when it comes to financial burden from healthcare costs. It's not going to solve the whole problem by any means. Healthcare is very expensive. It's one of the biggest things you will spend money on in your retirement. But the more you understand it, the smarter your decisions will be. And so I would say that is definitely step one, understanding what you pay, why you pay it, in what circumstance you pay what in, those different things. A lot of time we'll ask people, well, what coverage do you have? They don't even know. So getting just more engaged, more empowered in that, in your health insurance is definitely the first step to more financial clarity around healthcare costs, more confidence around healthcare costs. Again, it's not going to solve the full picture, but that is part of our mission statement, is to provide that confidence and that clarity when it comes to what has known to be this big black box. And I think that there is a lot of work that can be done by a consumer and by the advisor too, in helping people understand some of the basics, the foundation of health insurance.
I heard some alliteration in there. I'm not sure if you picked it out, but get educated, get
Yeah.
engaged, get empowered for confidence and clarity.
You got it.
Wonderful. Christine Simone, CEO and founder of Caribou. Thank you so much for this education today.
Thank you so much for having me and giving me the platform to tell more people about it.
You bet. And with that, I yield the balance of your time.